we're live.
Hi.
We're live.
Hi, everyone. Okay, it's such a pleasure to be here again with Dr. Morse in Florida. This time I have my good friend Lisa Marie Holmes with me, who's also a medical herbalist in Toronto. And we have Emily Elliott, Dr. Emily Elliott back there, who's a naturopathic doctor in Toronto. And we're all here soaking up your teachings because we know that this is the truth.
We had fun, didn't we?
Yeah, we
This has
did.
been a fun week.
Oh my
Really
goodness,
has
it's been
been.
inspiring, amazing. You soaked it in like a sponge.
Oh man, it's fun. Learning how to take someone that's in a wheelchair or someone with tumors in them, get the tumors out, get them up out of the chair, get them walking. That's what's fun.
No
Of
kidding.
course.
Isn't it fun?
You know, all the things that people get told when they go to a medical office, no, you're going to need this for the rest of your life. You're never going to walk again. You're never going to live life how you want to. You're going to have cancer. You're dying. You're this or that. I mean, that should be illegal.
It should be
Tell people
because
that.
people accept it and live
Yeah.
their whole life
Yeah.
that way because they're trapped in the mind. And so they don't realize that over here, another modality, the naturopathy group,
Right.
like us,
True
not the
naturopathy.
true naturopathy, not naturopathic
Yeah.
medicine, not the paleo eat meat people, but the true naturopathists know how to go in and regenerate the human body.
It's
And if there's degeneration, there's regeneration. Duality rules our day here, right? So it is cool to learn how you regenerate, isn't it? Look at
it
the
is.
cases you guys have been working on that you're curing them up. We've been curing them up for how long? So it's fun stuff.
that a woman who did a speech at the conference who healed her own Hashimoto's with your help and Graves' disease.
Yeah,
that
she
was
a-
incredible.
Yeah, that was an acupuncturist
Yeah.
physician. She had a
Yeah.
huge goiter, but some of the other stories in that room brought tears to your eyes.
Yeah.
Some were invalids. They couldn't move. They haven't been out of bed. They had paralysis. I mean, some of those stories just made me, and they found us, they got on the programs, they're walking, they have a life, they're talking, no more problems, from
So cool.
bedridden, couldn't walk. And you saw story after story like that, and that was good stuff.
Of course. Yeah.
But you guys know how to regenerate tissue, and that's the whole point of this.
Right.
You just have to learn a few little simple things that schools should be teaching,
I know.
and they're not doing it.
Yeah, and that's all it is regeneration. And then once you start eating this way, you can't go back.
Can't.
It's so funny
You can
because
cheat, but you can't go back.
I'll share a little story. So all week long we've been doing 80% fruit and just having some, veggie fruits for dinner, some tomatoes and salad greens and avocado.
It's pretty good.
We felt amazing. I felt the detox reactions coming on. Like
Ooh.
I was sneezing like crazy. My sinuses were draining.
yeah.
It was intense. And then last night, so since the program was over, we went to go to a raw food restaurant, which is still great, but there were nuts.
Oh, there were nuts.
There were nuts.
Yeah.
So what we were still eating very healthy, but just the fact that we had consumed nuts, which are high in
How
protein.
did you feel?
Our tummies were,
Really?
yeah, not
Terrible. Terrible. Yeah, and my detox reactions stopped.
Did they?
Yeah.
Yeah, see, I got beat up for talking about nuts and how you got to be very careful with them because they're
Right.
protein.
Right.
And look at your experience, and that's been my experience.
Yeah, and then just imagine if we had something that was really bad, like dead animal tissue
Oh,
or dairy, or
Exactly.
Well,
Look at
acidity.
it
I
with
love
pain.
pizza. You love Indian food? I love pizza.
If you keep the meat off of it, you're on the starch side. I
Yeah.
had a medical doctor come to one of our classes one time, and he came in extreme pain in the right kidney, and he was coming in roping like this. I put him on raw, right? Put him on fruit, and then we had the herbs for the class people.
Right.
Second day, pain's gone. Third day, better. Fourth day, better. He's going, man, I can't believe it took the pain out. I'm doing good.
Yeah.
Fifth day, we're having a raw food kitchen showing people how to cook or prepare raw foods.
Yeah.
And we did Giuliano's meatloaf, which has nuts.
Oh.
And I said, hey, Doc, I want you to try a little bit of this. It's just a nut loaf.
Oh boy.
As soon as he took his second bite, he went down on his knees. Oh, my God, what is that? And I said, that's protein. Never give it when you're in pain.
Yeah.
You know, people don't understand that.
Any
true.
kind of protein, and everyone's just so hung up on, where do I get my protein from my muscles and all this, and I have great muscles and I don't eat
No kidding.
basically any protein.
No kidding.
So it's all about the amino acids and
About the
fruits and
amino acids, not the
vegetables.
proteins.
And
And it's also about, do you digest your foods and break them apart? Do you absorb that nutrition properly?
Yeah.
Do you utilize that nutrition properly? And do you eliminate the metabolic waste from it? All those four phases are essential to be healthy. And people, are bumping on some of those phases, particularly malabsorption.
Right.
Digestion in a lot of people are off. People
Yeah.
are seeing undigested foods in their stool.
Yeah.
So how do you get healthy? How do you build muscles from fruit and vegetables like you're supposed to? Look at a herbivore. I always equate a horse
Right.
because we raised horses growing up.
Right.
You get a wild stallion out on the prairie. What's his diet? And look how powerful and big these guys are, or elephants. And then we sit there and we push proteins on humans.
I like your comment about the kidney pain because I've been experiencing kidney pain for about 8 years. And I went to every doctor, every kidney specialist, and they said it's impossible that you're having kidney pain because there's no nerve endings in the kidneys, so you can't actually feel kidney pain. And I swear to God, I've been suffering with kidney pain, and now
It's common. Yeah.
So I would say this. If you said that to an individual with kidney stones, he'd probably co-cock you.
That's true, eh?
Because I've had 9 of them. And they are, I was born
fun.
farming and milk drinking, gave me a lot of kidney stones.
Yeah.
And they're not fun. And what do you mean you can't get kidney pain? There's nervous system everywhere in the body. You have to have a way to neurologically turn on things and turn off things.
It's
The
true.
nervous system is much in control of the body as the endocrine gland system itself.
Right.
So to claim stuff like that, these all have passed sometimes. I don't know, they have some kind, maybe a little stroke when they're saying things or something. I don't know what it is.
Just a brain fart.
It's a brain fart. Because I'm telling you, these guys, I don't know what it is. Where they come from.
Yeah, it's pretty crazy.
It is.
But I love what you said about malabsorption because not too many people realize that they have malabsorption. And this is where iridology comes in and plays a huge role because you can easily see in the eyes.
Did you guys get our latest lymphatic iridology chart?
Yeah, in the training.
Well, we've got a few tweaks.
Well, just tell us what to get. We'll
Yeah,
get it.
yeah, the training. Okay.
Because iridology, nobody teaches lymphatics.
Right.
We're all teaching lymphatics.
Exactly.
The system that's causing 99.999% of man's problems.
Right.
We're all focusing in on. The world has to follow us because we're curing everybody, and they aren't. So they just have to turn and look at that.
And everyone needs it. Everyone needs to clean up the sewage system, which is the lymphatic system. There's not one person who has an ailment that doesn't have to target the kidneys and the lymphatic system.
I would say this to anyone out there that like mechanics and stuff like that, that when you burn fuel over a period of time, you build up residues. Even though there's an exhaust going on, you're building up residues, right?
Yeah.
If you burn dirty fuel, it's even much worse. So when you burn dirty fuel in the human body, which dirty fuel in the human body would be an acid-ash food. Food that, when it's broken down, has an acid kick to you. That's dirty fuel.
Right.
Exactly.
That's a corrosive kick to the body, and of course the kidneys and the colon get that kick.
Right.
That's why there's so many kidney problems. Colon cancer was #1 for generations.
Yeah.
Yep.
It's acids.
Acids.
Yeah.
Burning the
inflammation.
acid side of chemistry.
Exactly. Yeah. And I'd love to bring up, I know we talked about this a bit last time, but cancer. I think not too many people understand that cancer really all comes from the same thing, right?
Same thing.
And it's all treated the same, no matter if it's a tumor in the brain or if it's leukemia. So can we just tell people how to view their cancer and what they should be doing about it?
I think this is probably the most important subject given the fear behind this subject.
Yeah.
And it's undue fear. Because when someone says the word cancer, everybody cringes because most people die from it, right?
Right.
Actually, most people die from the treatment of it as opposed to the cancer
Yeah,
itself. So let's look what a cancer is. When someone dubs you having cancer, what they're saying to you is that you have a cell, because that's all they generally biopsy is one cell. You could have several that have been damaged to the point that you can't rebuild it. It is decayed, and you can't. It is covered with mucus. It's covered with a plaque. It's covered with acids that can't be out of the cell. The cell had been acidic inside the cell, so it's intracellular acidosis, the mutation of the DNA and all that, right? So there's a point where that cell, generally speaking, would be taken by the body, by immune cells, to the lymph nodes where macrophages, which is your cannibal cells, would then terminate that cell, and everybody's good. When a cell's damaged, if it's an atypical cell, you can rebuild it pretty easy.
Yeah.
But if it's past a certain point, then a pathologist, histologist is going to say it's a cancer cell. All that means is that you have a cell or 2 or 3 or 4 that's been damaged.
Yeah.
Tumors are not cancer. Tumors are just a pocket of fluid. Look it up in a dictionary. Pocket of fluid. What type of fluid though? That's where the problem is that it's acidic slurry. And it's acidic slurry. And as that tumor expands, you can have a tumor the size of a football in you and live forever. As long as it doesn't press on digestion, heart, blood, nerve, you're going to live forever. Look at the lady with the 303-pound ovarian cyst. You know, it didn't kill her, but she had a 300-pound cyst on her.
Yeah.
I mean, that's the sort of thing. So what they do, because it's an acid condition, they don't understand that. They treat the body with high acids.
Yeah.
And that's what further destroys the body. Because those cells have already been isolated.
Yeah.
No, they go ahead and go through your blood, feed this chemo to all your good cells, and of course they break down then.
Your whole body.
The whole body breaks down.
They're radiating people's brains,
Right.
everything.
Oh, these guys are out of control.
Yeah.
They have no clue about tissue and damage to tissue. They have no clue to what causes their diseases. You know, when you realize medical people created this illusionary concept of disease,
Right.
no one knows what causes them, right? You can treat them only with toxic pharmaceuticals, and of course there's no cure.
Yeah.
You want to go to a physician like that?
Yeah.
But everybody
And they're
is.
still searching for the cure, and
Yeah.
there's billions of
Still
dollars
seeking
being
it.
spent.
Exactly.
But the cure is so obvious.
And we've been
it's so
curing all
simple.
those people with those types of symptoms for how long?
I know.
Yeah.
Yeah.
I have for almost 50 years. So.
And it's amazing. And you have all the stories and people to
Oh, we got
testify.
stories so
prove
many
it.
miles long now. It's
Yeah.
fun, isn't it?
Yeah.
All around the world now, which is fun.
It's
Because
true.
now they can't stop us because it's
Yeah.
all around the world. People are getting well. In these countries,
Yeah.
people are calling us and writing us like, what?
Aw.
You know, I had these big tumors, now I'm tumor free and all these
Yeah.
things like that. And it's like, and we don't even know them.
Yeah.
I know, that's fun stuff.
Amazing.
Yeah.
And so another thing I want to mention is everyone is getting hung up on the ketogenic diet for cancer because they're realizing, oh, this might be acidic, and if you eat a high-fat diet, it may temporarily show you an improvement because fats buffer acidity.
Exactly.
But why is that so wrong?
Yeah. Well, because
Beyond that diet.
ketosis,
Yeah.
you know, you go into that whole world of chemistry again. Man's main diet, of course, is fruits, berries, and melons. You can say that he can handle vegetables, but
Right.
when you look at a food source like that, it's not a lipid-dominant food source. It follows mother's milk, basically. Your carbon
Right.
is your highest because it's the energetic source in the food. Then you've got your lipids, and then you've got your amino acids. So it kind of follows that chain, which is appropriate chemically for the human body.
Yeah.
Right? When you bring lipids up to the top, then you run you're moving the body to another acidic level.
Exactly.
Even though people don't realize ketosis is just another form of acidosis, and
Right.
it kills. Ask any diabetic,
Yeah.
you know, about ketosis. So
Yeah.
the whole point is just
Great
what
point.
what you said, is that lipids are antacids. That's why the lymphatic system is a cholesterol-based system, and all these people having cholesterol problems, it's in their face what system is down in their body.
Right.
But no one's telling them that it's because you're too acidic. You're eating acid foods. You're not getting rid of metabolic waste in your body. Your kidneys are not filtering. And that's a big one, is the kidney filtration, isn't it?
Yes.
sir.
Yeah. Exactly.
Got to learn how to filter your kidneys, because if you don't, if you pee in a jar and it's clear, you're in trouble.
Everybody's
Big
so
time
scared
trouble.
of fruit though. They're like, it's gonna make me fat. I'm like, oh my goodness, a banana. Even when I first started, I remember going to Erica saying, okay, you're sure I can have 2 bananas today? And
Well, then
she's
you
like,
wouldn't work with
prob-
what's his name, because he goes, what, 60?
yeah. You know, but that's what the mindset that we were trained in at our naturopathic
Yeah.
college
Yeah.
is that fruits are high carbohydrates and that's
Isn't that funny too?
fat.
And how ridiculous is it? Because fructose is a simple sugar like glucose, in my opinion, is superior to glucose,
Oh,
right?
yeah. Yeah.
Very much so, when you realize no insulin needed for glucose. And then the medical doctors have this concept that fructose is converted to glucose. Why would you convert a superior simple sugar into a inferior simple sugar? That's
Yeah.
ludicrous. It
No,
doesn't happen.
exactly.
So, but that's the sort of bull that's out there, the sort of lies that's out there.
Right.
And I give this analogy, guys. Fructose tastes sweet like water feels wet. Right? But
Yeah.
water's only 2 atoms of hydrogen
Yeah.
and 1 of oxygen,
Yeah.
and yet it feels so wet and
Right.
becomes a universal solvent.
Exactly.
So if people
Yeah.
people thinking about high corn syrup, high fructose corn syrup,
Well, that's
things like
completely
that.
different, exactly.
Totally. I mean,
Yeah.
someone tried to bring fructose into that. And I addressed that on one of the YouTubes, because that argument was, give us some respect that we have a mind.
Yeah.
I mean, that's an insult to intelligence when you're saying high fructose corn syrup is the same thing as fructose in fruit.
It's ridiculous.
I mean, come on.
Yeah.
I just wanted to say we have some comments. A lot of people are engaging. They're saying, hey, thanks, y'all, for talking about this. So true. Check out Reflection Medical. Sorry, it's hard for me to read. Anyways, just lots of positive love, and everybody wants to say hi.
Awesome. Hi. Also, okay, so I want to talk about this. So a lot of people, when I tell them back home, you know, it's all about the raw foods, high fruit diet, and people try it for the first time, a huge barrier that they come across is they start feeling very tired right away. And they're like, no, I'm still hungry, I'm tired, I can't get through my day. So what do you say to people like that?
Well, of course, a lot of people have the opposite reaction too. They have a lot more energy.
Of course, and I do, yeah.
The thing is when you start on these type of diets, they're energetic. The fruits is the highest energetic food on the planet. Why would you feel more tired?
Yeah.
What happens is hydration starts to happen.
Right.
And as hydration starts to happen, because these are electrolyte-rich foods, right?
Right.
So as the electrons are being sucked to the protons of the acids, you're getting hydration. Hydration then removes edema. And so then you're starting to see different changes in all of this.
Right.
And of course your glands kind of go, because when the body's so acidic, initially it's a hyper state. And then it becomes extreme hypo state. But in that hyper state, edema sets in, swelling sets in, that sort of thing. So as you begin to hydrate and alkalize the human body, it begins to relax down. Well, the adrenals then go, and that's your neurotransmitters.
Right.
Then you get to see just how weak you are. You really, what it tells you is what problem they have. Because anybody who starts on a fruit diet and feels weaker is simply, that's the adrenals big time.
For sure.
So you got to go right there and work on those.
Yeah, exactly.
And that'll tell you probably their kidneys are not filtering, blah, 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 and go down that road. Lymphatic stagnation, acidosis, and then the swelling, and then the inflammatory response, and then the next stage after that is intracellular acidosis, and then they use that cancer word on the cell. That's all it is.
Yeah.
You know, and to ravish and destroy a human body with radiation and acid slurry because they don't understand the problem.
I know.
You know, karma flip back, you know, one of these days it's not going to be a fun picture for oncologists.
I believe so.
You know, you reap what you sow, what you put out. You know, we work in a dualistic universe. In this physical world, there's two sides of everything, and there's two sides of chemistry. And you got to simply understand there's only two sides of chemistry. The acids are corrosive, the alkalis are a little rebuilding. And you can get strong alkalis that'll burn you, but the acid side, that's where all the metabolites, that's where all these things go. That's the side that destroys you.
It's true, and as simple as that, cause and
Simple as
effect,
that.
like you say, you know, acid base.
And it was at university, PhD of Rochester. I like that this was a university, so they were telling you the truth. That he was talking about laying on your side to sleep because then your brain could drain, because he understood the glymphatic. Now, I don't know if his research team discovered the glymphatic system in the brain, but certainly he knew about it, which told me he was a higher aware individual. So he was saying you lay on your side right to detox your brain, and then he's talking about of debris. What was nice is then he went and defined the debris as metabolitic waste. Thank you. Now you're at why you have Alzheimer's, you're at what amyloid plaque is, you're at what all this buildup interstitially around the cells is. And that is acids from cell metabolism.
Right.
How do you get rid of your metabolitic waste? That's a universal question.
Yeah.
If you listen to the medical community, when they found the lymphatic system, University of West Virginia, the medical doctor made a statement that we thought the body got rid of the waste esoterically. Esoterically. That's from a medical doctor thinker.
Oh
like,
my
well,
goodness.
you must have a little spiritual on the side, esoterically. Yeah, right. Like chemistry can just disappear.
Right.
Right.
Yeah. Oh, that's funny. And you know what? Detoxing takes energy.
Does.
So I know when I first started, I had the dip and I felt very tired, but I knew my body was just regenerating, right? And then when I came on top, there's nothing that gives me more energy now.
So
right?
what's the first principle in detoxification then? Because of what you just said.
Yeah.
Rest.
Yeah.
Rest.
Exactly.
Sit there and rest. You're taking your car into this body shop.
It's
So
true.
rest. You're going to get skinny. You're going to have some humps and dumps. You're going to have mucus coming out, tumors breaking up. You're going to start peeing all kinds of nasty stuff. Stuff's going to come out of the stool that's not too pretty and stinks like I haven't. You know, your underarms are going to sweat and stink like crazy, and pretty soon you're going to start smelling sweet again. You're going to smell like the food you're eating, and everything is there. Women's periods can stop and then start again. Because just what you said, the important thing what you said is, it takes energy to detoxify. The body's going to shut everything down. And with that said, this is why you eat the most simplest foods or you fast, because it's energetic. Everything is an energetic experience, right? And eating is energetic. You don't want your foods to be here because you won't detoxify.
No, of course not, because all the energy goes there to digest.
Nature will fast you.
Yeah, and actually, I'm very excited because we're starting a 21-day juice fast on Monday, and we have a couple other people joining us.
Oh, that's cool stuff.
You have to dig deep.
You have to dig deep.
Right? A 3-day fast isn't going to cut it, especially if you're dealing with bigger ailments, right?
Absolutely.
You have to be committed.
The biggest deep that you can dig is dry fasting.
Yeah.
The second deepest dig you can dig is water fasting. The third deepest dig is juice fasting.
Right.
And it just goes down that pyramid like that. Then the fruit, then the green drinks, and then the greens, and then there's nothing after that.
Right.
Not detox wise.
Yeah.
And you're lucky to detox on vegetables.
Yeah.
Lucky if you get a little done there.
Slows it down. Cooked food slows it down, and as we
hard to
clearly
digest for
saw,
Homo sapiens.
a little bit of nuts will slow it down.
Yeah, a little
Which
bit
is
of
crazy.
nuts.
A little
You
bit
saw
of
it for
protein.
yourself. A little bit of protein like that. It's funny. This is nuts. These are natural nuts.
Yeah.
But if you're in pain, the body does not do it. Proteins are acid forming.
Yeah.
So even a nut is acid forming. So it's like,
And so if someone just wants to live this lifestyle, let's say 100% fruit or 80% fruit and a little bit of vegetables,
that's what I do.
Do they need any other fats
I
for
would
their
say
cell
no.
membranes? Okay.
Because there's adequate lipids. Again, look at the body as a food processor, as a chemical processor. Your body processes chemistry.
Yeah.
So it takes complex chemistry, breaks it apart down to simple chemistry, right? Matter of fact, you can't absorb but the simplest components. Exactly what you learned, right?
Right.
So if you can absorb. See, and that's the point. Well, what creates malabsorption? What system are we back to? The lymphatic system.
Exactly.
All your body is cells and spaces. That's all your body is, right? Cells and spaces. And these spaces now, in the medical community, might be the new largest organ that they didn't know existed in the human body. They've known interstitial spaces since day one.
Yeah.
So what's these spaces full of? Around every cell there's spaces. Even bone, what's that full of? Blood and lymph.
That's all it is.
Kitchen, bathroom.
Right.
Simple. Everyone out here can understand that. Like, oh, that's easy.
Yeah.
One feeds and one cleans. That's easy. You just don't feed something. Everybody has to poop or eliminate waste, right? Even your dog. Plants shed. So everything gets rid of. Just because you don't understand it doesn't mean we don't.
And then another thing I hear from a lot of men is they don't want to lose their muscle mass. So what do we say to them who are muscle building and going to the gym and working hard?
That's a good one.
Yeah.
Because we're fortunate to work with Mr. Olympia and with Antoine, who trains Mr. Olympias and stuff. And so their problems are what we've introduced them is why they're getting the RAs, why they're losing their joints, why they're blowing rectums, why they're doing all that. And that proteins suck calcium out of you. You can put on big bulky muscles with proteins, but what comes with that is acidosis, stiffness, tightness. Now they look pretty for a while, and then the joints start going.
Right.
And then your kidneys, and then the lymph system, and it is a nightmare what these guys go through. And so you learn to go to plant-based amino acids, which has an alkaline slurry, as opposed to protein, which has an acid slurry. Big, huge difference between an alkaline hit on the body and an acid hit on the body. If you eat acid-forming foods, your body has to rectify that, right? Your blood is 7.4 pH, it's alkaline. What happens if you dump acids into an alkaline blood? Yeah. You out-oxidify the blood too much, what happens?
You can die.
3 minutes and you're done.
Yeah.
So the body's going to steal calcium out of that basement layer of connective tissue. And that's why we see varicose veins, spider veins, bleeding easy, and of course the link to depression.
Yes.
There's so much depression out there, people don't realize that's the parathyroids, that's calcium utilization problem. It's not a mental problem, it's a physiological problem.
Exactly. So another one that keeps getting brought up is the Zika virus. I have a lot of friends who want to go and get pregnant and travel.
The Duchess or whatever her name is, she's got spray all over, and she's got
Yeah.
She's out traveling with Harry or whatever it is.
Oh,
she's got,
right.
she's got
Oh.
because she
My
didn't want
girl.
to get the Zika virus. That's what the news is saying. So she's got this bug spray all over, and I'm going, I wonder which is worse.
Yeah, the chemicals in the bug spray.
You know, the lies that
Yeah.
we hear. I was sent a letter by a doctor down in that area who has, that's his home. And he said, it's funny, we didn't have the Zika virus till the vaccines were introduced.
They're
down
working
there.
on a vaccine.
So what it is
Yeah.
they feel the Zika virus is another one of those virals passed by the vaccines.
Oh.
Yeah, and it's not naturally found in nature, put it that way. So that was from a doctor's point of view to me down there.
Okay.
I'll say this, any viral load, we talked about this before, if you come down with a viral load somewhere, it's easy, these are just proteins, like the HIV or Hep C or whatever, there's only one way to get remedy. And you know it, there's only one way to get rid of proteins out of the body.
Just detox them out.
Detox them out. When the body's acidic, when you're acidic, it creates what they call a cationic environment. It's an environment of agglomulation. In other words, it rips, but it dehydrates and dries out. So things become hard. Mucus becomes hard. Tumors can get hard as a rock.
Right.
Not good. It'll get you harder. You model and you turn in and you do like you see advanced MSs and all these. You just have to modeling everything. No. That's acidosis.
Yeah.
And look at what we can do. We can take someone that's like this modeled and open them up, get them up, walking again. And how do we do it? We get them on the other side of chemistry. You can't keep them on the same side of chemistry and claim that we can't get you better, there's no cure, but we're going to look for one down the road somewhere when they're simply living on the wrong side of chemistry.
Yeah.
It's like, what?
And that's just how much your foods impact you.
Exactly.
And we're taught to become so separate from the foods that we're eating. You go into a grocery store and you just see rows upon rows of junk, chips and box cereals and cookies and candy bars. How do you think that's going to nourish your body, and what effect do you think
There's
that is
only
going to
a place
have?
to go in the grocery store, and that's the produce section.
Exactly. And the fruits and the vegetables, and not even the cruciferous, because those are too hard to digest.
Exactly.
You want the veggie fruits if you're going to have
Thank
any,
you.
right? The avocados, tomatoes,
There was
cucumbers.
exactly.
Yeah.
There was a health food restaurant opened up in Sarasota up here. There's several up there.
Yeah.
But this one just had predominant cruciferous dishes for some reason. Broccoli and cabbages and stuff.
Too hard.
So I didn't realize that. I went in,
Yeah.
I was looking at the menu going, wow, everything is cruciferous. Well, that'll rip you. Especially if you already have sulfur deposits in your body.
Right.
And then you're going to go into a cruciferous, which is sulfur based. You can get really gassy, bloaty, and everything else.
For sure.
So I walked out with gastric distress. And of course that a month or two later she closed down. You can't, you got to wake up a little bit.
It's true, yeah. And just be aware of the foods that you're
Even
eating.
our people, I want to promote more. When we have these fruit and vegetable festivals and stuff, we want a lot more fruit.
Yeah.
Fruit. That's Homo sapien food.
Yeah.
We're islanders, not paleo people. The Homo sapien origin is islanders. And you look at that, we're primatish, we're frugivores. And I know they tried to label primates omnivores, but that's without the thinking mind, unaware mind.
Yeah, can you imagine?
A primate is far from a bear and a dog.
Exactly. Oh, I
And a
know.
hog and a chicken.
Another thing I wanted to mention is everyone feels they need to run for antibiotics anytime that they're sick or have any kind of infection. Well, I mean, it doesn't help that a medical doctor will just prescribe them like candy sometimes, but for UTIs or, any kind of bacterial infection, that's the go-to remedy. So what do we say to that?
That's
Yeah.
probably one of the most superb questions of the day, because it is because of the wonder drugs like penicillin and stuff that we're all in trouble.
Right.
You have to understand the role of bacterium in nature, and when you say infection, what you're really meaning is concentrated acidosis. That's what's infectious. When you feel pain in your bladder, like in cystitis, that isn't bacteria causing the pain. That's acids causing the pain. Bacteria's job is to break down the metals. Bacteria break down metals. And so that's what their job is.
Yeah.
And they're there to help.
Yeah.
So medical doctors unmistakably blame the bacterium for the problem as opposed to the metals, the acids that's causing the problem. Kill the bacteria and your metals have nothing to stop them.
Yeah.
Nothing to stop them. So taking antibiotics destroys the bacteria in your lymph nodes. Well, think about this. At the cell level, metabolitic wastes are 3 pH. That's about Coca-Cola, Pepsi, that level. Dr. Pepper, that's all about 3 pH, right? So when these acids are going to the lymph nodes, those bacteria bring it up to 6 maybe. Because when you're peeing, you don't want a P3, you want a P6.
Right.
You know? If you P3, you're going to be on your knees.
Yeah.
Right?
Yeah.
Just take a swig of Coke and hold it in your mouth, and that's what 3 pH feels like.
Right.
So that's what's burning and hurting. When you feel burning, that's not bacterium, that's your acids burning you. And that's what you have to get out. And so they compromise people's immune systems by killing the bacterium in them. Stupid. And if you get gnarly bacteria, you're eating meat. E. coli is people have E. coli them all the time anyway. You just see more aggressive outbreaks for some reason. Like Morse is another reason. Everybody's so scared of all that crap. It's like, excuse me, clean your inner terrain.
Yeah.
You're just a call of the wild.
Yeah.
You're eating food that creates sewage buildup in the body.
Exactly. And don't get rid of the bacteria that are serving you.
No kidding. Now
Right?
you're all fighting gut bacteria problems, Aaron, because you just killed them all.
Yeah.
Thinking that you took care of the problem. How many people know? You know, you're diagnosed with lupus or Lyme's, first thing you give you antibiotics. And it's not a bacteria. Or you get bit by a recluse. I love this one. You get bit by a recluse spider and you get antibiotics. It's an cytotoxin. They don't have anything for that. Only the botanical kingdom.
Yeah.
Our side can cure those things.
Love our plants.
I love our side.
And so back home, a lot of people are getting diagnosed with Lyme disease.
Yeah, I bet.
It's rampant. And
It's
the first
rampant.
thing is
It's like everybody
doxycycline.
gets bit by a tick or something, you know. It's just ridiculous when you look at. Well, there was a special by Jesse Ventura about the Lyme viral and all those sort of things. And there's this research lab up in New York, you know, and they were talking about how virals get out of the lab by doors opening and things like that, you know. But it is what it is. So you have virals in our society. It's going to get even worse, you know, with the chemtrails and all the dumping of the toxins and all this crap. So it's going to get a lot worse. What does that mean to you? That means if you don't clean your physical body out and get it into an alkaline anionic state, then when you ingest chemicals or radiation, it can't get out of you, because you've created a cationic state of stay-at-home, agglomeration, even radiation will stay in you.
Yeah.
And so you've got to open those doors of alkalinity and get and hydrate your body and get it into an alkaline dominant state. Yeah. And that comes naturally in fruits, berries, melons, and vegetables.
Exactly.
An alkaline dominant state in chemistry.
And then you'll have the best quality of life, right? A lot of people just don't want to give up things because they think, oh, I want to live. But you're not truly living until you feel like we do.
Exactly.
Then
That's
you're
the
living.
point. Just because you can walk to the car and turn it on. Yeah.
Right.
Yeah, right.
Yeah.
You want to be vital and good all the way into your 90s or 100s if you want to stay on this planet that long.
Right, exactly. I know, there's better worlds.
Well, there's much better worlds by far. Much better.
Another thing that we commonly hear is, oh, you have autoimmune disease.
Oh,
Everyone's scared
I
that they
love
have
that
autoimmune disease.
Oh.
What does that even mean?
You know
I have
what?
celiac disease, so I was diagnosed with an autoimmune disease.
When you create a theory that holds no scientific prudence, there's no way you can prove medical theories because they don't exist.
Right.
This concept of diseases is ridiculous. When someone says you have an autoimmune problem, the first thing you can take to the bank, they haven't got a clue what's causing your problem.
That is a hard pill to swallow.
Yeah, it is.
right?
A hard
People
pill to
that
swallow,
you
but when
trust.
they say it's your autoimmune problem, and now everything, if you notice, diabetes now is an autoimmune. All these are autoimmune problems. Simply means, I don't know.
Yeah,
Well, how do you like to go to a doctor who goes, I don't know, but I can give you a chemical for the symptom. That's exactly allopathy. And if you want to live in that world, go ahead. But I think you, looking at man, it can demonstrate that the death rate and the harm rate from allopathy is astronomically. It's so astronomical, you can't even, the mind can't fathom how many millions of people worldwide are destroyed every year with chemotherapy, just with that.
Yeah.
And look at the pharmaceuticals that have fatal events tied to it.
Oh,
so you take
long list.
a long list. You,
Yeah.
you could take any. The good one would be Cipro, which is an antibiotic, major fatal event antibiotic. I'm sure 5%, at least 5% of people on Cipros had heart attacks, strokes, and maybe even death.
Yeah.
So you have millions on Cipro worldwide. So what would be, let's say you had 1 million people on Cipro, what's 5% of 1 million people? That many people die of Cipro every year. And it's probably more like 10.
Hi, we have a question wondering about what you think about CBD oil for anxiety. There's a big trend going on right now.
Are they taking the CBD oil or it's a THC in it further than anxiety?
Let's talk about both.
Because the CBD oil is more going to be an antacid. It's
Right.
going to be an anti-inflammatory.
The
Any
oil.
lipid is an anti-inflammatory. Well, it's a wrong name because inflammation is a natural immune response by your body. When you see an inflammatory response, your next question is to what? You know, because
Yeah.
it's your body responding to something you ingested in one way or another.
Exactly.
Whether you ingest it through the skin, you breathe it in, you sucked it down, whatever, right?
Yeah.
But
You have to go to the root cause.
you gotta go
right?
to the root cause.
Yeah.
If you have anxieties, it's your adrenal glands, no question. You want to go after those adrenal glands and the autonomic nervous system big time. You could use that, I suppose, for that. But again, the THC is a little bit of a neurotoxin. So it can actually exacerbate maybe anxieties a little bit. But, you know, go after your adrenal glands. That's the autonomic nervous system and the adrenal glands when you get anxiety. And the next site of that is the thing like asthma and the COPD change, you know, where it's a neurological problem of breathing as opposed to just a congestive problem.
Exactly. And too much THC also, we know that it affects your reproductive system.
All of that.
Sperm
all
count
of that.
and all of that.
You know, they're using a lot of cannabis in Europe, I heard. They found different strains were increasing. I was mentioning this microcirculation. You know, there are the medicinal sides of all plants. So investigating the medicinal side of that was incredible.
Yeah, absolutely.
Yeah. Awesome.
And it relaxes you at the same time. Right?
Great question.
Another thing that I want to ask you about is Botox. So can we comment on
Holy
the effects?
crap.
Because I know a lot of women personally, and
I just use the word insanity.
yeah.
You never want to have anything like even freeze-dried botulism, stuff like that. You never want to have anything that destroys the nervous system or suppresses or paralyzes the nervous system. Look at Elvis Presley's, Priscilla Presley and her face and what happened with Botox and that. Permanently destroyed. Excuse me. So that sort of stuff is ridiculous. If you're getting flabby and wrinkles, what's the problem? Parathyroid. You got it. And not too many people, you girls are good, because not too many people understand that. That's your connective tissue problems. And the parathyroid is how you utilize calcium. So depression, postpartum depression, your baby's growing pains and skeletal issues, connective tissue issues, parathyroid.
Yeah. And then it's, you know,
And if you're short or tall, pituitary with it.
There you go.
and as soon as you start eating fruit, your skin just tightens, it smooths
Exactly.
out. It gets so
Thank you.
vital.
Thank
That's the
you.
first thing I notice when
Thank
I'm
you.
eating high
You tone
fruit.
and tighten.
Is
And you smell sweet.
wow. Yeah.
And a good
You just-
comfrey face mask.
Yeah.
Ooh, a good comfort. That would
Right?
be good.
Yeah.
Oh,
You have to do that at home.
oh,
Yeah.
good thing,
It's
really.
amazing.
You know, comfrey's knit bone,
Yeah.
so connective tissue.
All that collagen production.
Don't you love botanicals?
Oh, they're amazing.
That we can do so many things with botanicals. They don't kill you. I mean, there's
Yeah.
some that will, but nobody uses those. But I mean, see, the beauty of what we can do with herbs, oh my God. And then we look at pharmaceuticals, fatal events, or some type of major harm. It's like, what's wrong with this picture?
Yeah, it's.
I
That's
truly
what's
think
wrong with
that
this
herbs
picture.
are God's gift to us.
Exactly. Thank you.
Right?
It's true.
Yeah.
You know, it's back to the Rockefellers, the trilaterals, the world order people, that sort of thing. It all goes back to those people. And if you want that, it's kind of like we're going in our society. You either want socialism or you want to have constitutionalism.
Exactly. So I'd like to jump back to one thing. We were talking about autoimmune. So Wagner's disease, someone in my family was diagnosed with that. And so that's, vasculitis. And what the doctors did was put her on immunosuppressants. So let's suppress your immune system when it's the very thing trying to serve you.
That's because they think it's an autoimmune problem.
Right.
The problem is,
Exactly.
I'll ask you guys this. Describe your immune system in your body, please.
Yeah.
Yeah, you got some immune cells, but
Yeah.
what's the immune system? So that would be a system that would clean you, right? The immune system. It would have immune cells. It would also have the macrophages to take care of anything, right? It would have that whole setup.
Yeah.
There's only one system in your body with that setup.
Yeah.
The lymphatic system. All set up.
Yes, Emily?
Do we have any thoughts on diet and ADHD?
Same thing. You know, here's the biggest issue here. The Homo sapien is the most neurologically active species on this planet. The primates and the Homo sapiens can create tools and build. Primates don't build skyscrapers,
Right.
that sort of thing. So this is neurological. It's also the CNS power, it's consciousness, you know, all that sort of thing. The only food on the planet designed for that level are the fruits and berries. They're the only ones with about 12,000 angstroms or 12,000 magnetic resonances of
So
energy.
electric.
Exactly, they're
Yeah,
electric.
feel it.
So we've told you before, and
Yeah.
you can witness this in your own practice by working on an MS or Lou Gehrig's case, right? Where you've got them on fruit. They're in a chair, they're modeling everything, and then suddenly they start getting up, they start walking,
Yeah.
that sort of
They're
thing. Then put them on vegetables and see what happens.
Yeah.
They start to lose that and they go back to where they were. And we've shown this and demonstrated this so many times, it's in our face. So when you come to me with the neurological, it's fruit only, fruit and berries only, that's it.
Oh yeah.
And then you watch the magic.
Yeah.
And that's what it is. When you're in ADD and things like this, it's neurotoxic. And I don't care what they say, pharmaceuticals are responsible for 99.99% of ADD and ADHD and all this, thimerosols and all these neurotoxins. A lot of neurotoxins in society, even women's perfumes can be neurotoxic.
Of course.
You've got to get the neurotoxin out of these kids or people, and at the same time, you can enhance the neurological system through the fruit diet and through botanicals for the nervous system.
Yeah.
Absolutely. We rebuild man's nervous system all the time.
Yeah. And easily.
Not difficult
with the
to do, but you got to detox these children. They should be on fruit anyway. If you want a smart child, a child that's not in the ER all the time, you know, with colds and flus, mumps, measles, and all that crap, you know, and you want a healthy, aware child that's going to escalate in their awareness faster than most kids around them, put them on fruit.
Yeah. And as early as 4 months.
As early as 4 months.
Get them chewing their
It's
fruits.
early. Jennifer
And only
did hers at
fruits.
3.
Yeah.
And they're extremely intelligent.
Yeah. Yeah.
But we got people that, but it's because of the milk situation today. These babies are lymphatically compromised. Milk, even mama's milks are acidic now because mamas are eating acidically.
Yeah.
So that's the problem. Mamas are going to have to realize when you see your baby with mucousy colicky, whether you're on formula, get them off because you're going to fill your baby full of mucus, and babies now are getting a lot of tumors from this.
Yeah.
Oh, it's so sad.
And you know, just rewiring the conditioning around food. So people need to understand that they can live on fruit and the healthiest.
Extremely.
fruit.
Well, you guys are
Right.
Canadian, so
Yeah.
the problem is you're in an atmosphere that could bring you into the vegetable side because
Yeah.
you're more earthly, more that sort of thing, more northern.
Right.
The fruits are more tropical, but man is not designed for northern climates.
No.
You notice what we have to wear up at your place.
Oh, it's
Here you can
freezing.
take your shirt off and be naked if you want.
Right.
Up at your
That's
place
not
in the
gonna-
winter, that's not too possible. You freeze your butt off.
Yeah.
So you can't, it's hard to maintain a high alkaline diet in a high alkaline environment because cold is alkaline.
Right.
So when you're in a high alkaline environment and you're trying to eat alkaline, it's a tear because nature dictates opposites attract.
Right.
So you have to have a balance between the cold and the heat. It comes naturally in fruits, berries, and melons, but your environment must also contribute to that factor.
Exactly.
So that's one of the problems we run into with that.
I guess we all
hard to
gotta
do.
move or travel in winter time.
Yeah, stay warm with teas, stuff like that.
Yeah, ginger, warming herbs.
Come to Florida,
Yeah.
warming herbs. Come
Yeah.
down to Florida
Come
in the
visit
winter.
Exactly.
Good answer.
Yeah. So, as a naturopath, we do a lot of blood work and we keep our eye on numbers. And I know a lot of friends that are mine that are naturopaths, they get a little worried if there's any kind of deficiency because in school we were taught, oh, you have to supplement iron, you have to supplement B12. And I understand it, although I don't believe that. What's your take on any kind of deficiency and what can be done?
Well, I've said this before because deficiencies fall in our field, right?
Yeah.
And I've said before you can ever say deficiency and go after this thing that plants the topsoil is no longer, but roots are not getting off the topsoil. They're going down looking, and roots will always hunt for nutrition, you know. You have to look at what we were talking about earlier. You've got to be able to digest, absorb, utilize, and eliminate. So let's take iron for an example. A lot of people that are iron deficient or they are somewhat anemic, they go to the liver, right? Well, first you have to understand that when you digest your foods, the second step is absorption. Well, there's a third step. When you pull calcium and iron and all this from your foods, if you can absorb, you got to correct those before you can say deficiency. You got to correct those, right? You can't say deficiency and you're not absorbing your nutrition, right? Right.
Right.
So
Great
The
point.
next phase is utilization. Well, that comes back to the sweethearts we talk so much about, the adrenal glands. They produce, what, 25 mineralocorticosteroids or more? So iron needs a steroid for utilization. Until you realize that and go to the adrenals and fix that, fix digestion, fix absorption, you can't holler that. You can throw iron into the system and then balance body chemistry. And now you've unbalanced your patient's or your client's chemistry
Yeah.
because you thought they need to supplement iron. Remember, we talked about that in school.
Right.
Chemistry is a family.
Yes.
We're in a created universe, already created. And so chemistry is already created, and it's dealt with through pH factors and ratio factors. And when you start breaking those ratios apart, that's stupidity. You don't do that. You unbalance body chemistry. But it's those people that don't understand how to get people well and what the problems are. Those naturopaths are deficient in themselves. They never went deep into this road. But schools, I blame the schools more because their curriculums aren't what they should be.
Right.
You should have the natural hygiene. Should have Braggs. You should have Eris. All the people that dealt with natural healing, fasting, detoxification, the chemistry of foods,
Right.
that sort of thing. Not the concepts of stuff, the actualities of stuff. Yeah.
All right, I have one more question. Someone wants to know if you have low red blood cells or low hemoglobin, what do you do? And I know you have a good bone marrow formula.
Good bone marrow formula.
Yeah.
And again, when you're running low in the reds, we just talked to you about getting the kidneys to filter. And if you can impart any information here, kidney filtration, because without that, you're done. You're stuck.
Yeah.
And kidneys must filter. Kidneys and skin are your doorway out for metabolitic waste of the human body. When you're looking about elimination, think eliminative organs. People in our field used to call the liver a big detoxifying organ. Actually, the liver is the chemical factory of the body. It's a transportation factory. It is an amazing chemical factory. It is your eliminative organs that are the detoxifier, the eliminative organs. So the kidneys eliminate the cellular waste, the metabolitic waste along with the skin. Your colon is your digestive waste, right? So if you're peeing clear water, basically, where's your metabolitic waste?
Exactly.
You show your metabolitic waste by white sewage, white sediment, or mucus threads in your urine.
Right.
And if you don't have them, you're not filtering. Ask yourself, where's your acids going in your body? Oh, I feel a little tight, a little swollen here. My lymph node's swollen here. My feet are swollen or whatever. That's where they are.
Exactly, and you really, you have to pee in a jar, right, in order to see the sediment.
Pee in a jar and look at it.
Yeah.
I don't know where he keeps his charts, but I have mine, and I'm always showing what it looks like to have kidney filtration.
Right.
And you've got, if you take those little Santa Claus things for Christmas and you shake the little balls of glass and they sit, and you shake them, you see all that little white snow.
Yeah.
Snow globes. That's what your urine should have, is metabolitic glow.
Yes.
Okay.
Exactly.
Metabolitic
Exactly. If it's clear, and you see all of our groups are working feverishly to get, and once they get the kidneys filtering, everything changes in their world.
Yeah.
Your tumors start coming down, because if your outlet is closed, there's nowhere for tumors to go. That's why you form them. Why would you get boils and pimples and things like that?
Yeah.
Nowhere to remove your waste. And if you're consuming dairy products of all types,
Adding more.
you're pouring acids and mucus into your body. You're pouring it in. Your sinuses, your lungs, your bronchi.
Yeah. Any sinus congestion, any snoring, that's all the congested lymph.
And that's what you see when you detox. First thing out, some mucus you put in.
Right.
It's like, I mean, it's like, excuse me, but that you put it in there, it's what's coming out. The guy didn't do it.
Yeah.
You didn't catch anything.
And
You created it.
It's true. And it can take time to filter.
Takes time to filter.
And everyone's different and you have to be patient, but if you do this type of work and you're on the right path, you will see the benefits.
You will.
Right?
You
It
will.
depends
I've
how
never seen anybody not get their remedy if they stay and get focused along. But some people are more difficult than others. Some are more genetically weak in different tissues. Some are stronger. Some are more lymphatically compromised than others. Some are chronic. Some are only acute. You got all levels. Some are, not they've been ratted out with the allopathic community, so they're mentally not well. They're emotionally not well because their adrenals have been down their whole life. So these people are thrown into to corners and stuff where they don't know anymore. So we have a mess on our hands because of allopathic stupidity. These guys don't have a clue. They're only surgically inclined, and that's where they should be.
Yes.
And I spent years in emergency rooms, and we can improve them by far.
Right.
But emergency medicine is allopathy. Period.
Not for chronic
Period.
disease.
Nothing to
at
do
all.
with health. They don't have anything to do with health.
Yeah.
They're the treatment of diseases which they fabricated.
Yeah.
That's a fabrication of the medical mind, is diseases.
And I couldn't tell you how many times the patient will walk into my office and say, "Oh, my doctor said my diet has nothing to do with how I feel."
Geez. Yeah, the chemistry you're ingesting has nothing with the chemistry your body is dealing with. You know, that's about as stupid as you can get. When
Right.
your ingestion of chemistry has absolutely nothing to do. I suppose what gasoline you put in your car has nothing to do to running it.
Yeah.
Exactly. And you wouldn't put diesel fuel in a gasoline. Of course, it wouldn't matter, according to them. You could run diesel in a gas motor and all that.
Yeah.
That's not the case.
Right.
You can't run meat in a frugivore motor without having serious blowbacks.
Yeah. Yeah.
It's just the way it is.
Yeah. I mean, you really have to look at it that way
I know.
and cleanse and detoxify and
Exactly.
use the herbs.
Use
You
the
need
herbs.
the
Have fun with
herbs.
the botanicals because
Yeah.
they're here for that. Botanicals are not for diseases, guys. That doesn't exist. They're for body parts.
Yeah, they're targeted.
They're for
specific
targeted
organs.
body parts. You got herbs
Yeah.
for the kidneys, herbs for the liver. You got herbs for the lymphatic system, for tumors and stuff. It pull it right out of you, right?
Yeah.
You've got herbs for the heart. You got herbs for. That's the beauty of this. We're not treating phantom diseases made by the fabricated medical thinkers.
Yeah.
No, we want actuality. We want cause and effect. Physics.
Yeah.
Cause and effect. For every action, there's an opposite and equal reaction. Science.
Yeah.
Strong science. But
Yeah.
we bring science, and you know what they call us? Pseudoscience people. Really? I'll take exception to that. I'm a chemist. I'll take exception to that.
you know.
We teach chemistry and physics. We don't teach some pharmaceutical pseudoscience of disease. And of course, this will only treat the symptom of it. Could kill you treating it,
Yeah.
or it could cause a numerous amount of problems treating it. But you still probably need it. It's like ask your doctor if you need it. Of course, he's going to say, "Sure, yeah."
And they scare people.
Oh.
They scare people.
Of course they rule by fear, and that's not how
Yeah,
we rule.
they
We rule
say-
by love and awareness.
I've heard so many times that doctors have said, if you're not taking these drugs, this is the only thing keeping you alive.
I've heard that too. Someone said that about chemotherapy. Heard that in the group.
Right.
That was
Yeah.
one of our clients. They said that the tumors are all gone. Everything was gone in them, but they need to stay on the chemo because
Yeah.
they'll die if they don't. It's like,
Yeah. And the doctors get a big fat paycheck for
exactly. That kind
Right.
of physician should probably turn in his degree and go find something to do, maybe digging ditches or something, because that's about the mentality of that person. That type of person is a killer, and you have to be careful with that because they don't care. They have no compassion. Look at how cold an oncologist is, and look at how cold a female oncologist can be. I mean, when you juice babies, you're pretty cold. Because
Yeah.
these guys do know that the chance of your survival under the juice is not high,
Yeah.
but they still do it. What person does that?
It's horrible.
It's horrible.
And how do you help someone whose doctor is saying this? You have to stay on the meds or you're going to die, and they don't want to stay on the meds, and they want to do things
Awareness.
this way. Yeah.
Let's say, truth transcends. And you sit down and explain basic chemistry. No one could deny.
Yeah.
Basic physics, energy. No one can deny the energy in foods. We have pictures, brilliant pictures of the energetics of foods, raw and cooked. And what happens with the energy, magnetic energy, when you cook or process a food, destroys it. Everybody's talking about, I want energy. They're eating cooked dead food. And
Yeah.
they're going, well, how come I don't have any energy? Because you're eating cooked dead food.
Yeah.
You're eating 1,000 or less. Think about this. The average person probably gets less than 1,000 angstroms a day if they have no greenery or anything, salad
They
on their
walk
meals.
around.
They have less than 1,000 angstroms a day.
Yeah.
The body is required to have about 7. Fruits are 12. Vegetables are 9. Basically. So look at the difference. You even feel better hooking to vegetables. You notice?
Yeah.
But that you reaches the plateau real easy. And then when you hit the fruit, it pulls you way on up. Yeah, big difference when you're playing with that.
And then the moment you step down from fruit,
It
wow.
kicks your butt. I used to, saw people for years. I don't see anybody anymore, but I used to see people for years. And I'd go to lunch and have a big salad and come back and go, oh, man, I just need to take a little nap. Fruit would never do that to you.
Never.
Do that to you. Never.
Of course. Yeah, it's pretty incredible. So I hope we really send that message that, eat more fruit. Don't be afraid of the sugar.
It's fructose. It's simple sugar.
Yeah.
Simple sugar. You can't get any more simpler in chemistry than that compound, simple sugar. You can break it down to the carbon chains,
Yeah.
and the oxygen chains. Yeah, you can break it down to the elements, but you can't break it down to any more in a simpler complex like
Right,
that.
yeah.
That's as simple as you can get. And converting it to a more inferior simple is You know, there's so many ridiculous statements out there.
I know. And everyone should have this diet, no matter what ailment you have, what disease you're diagnosed with. It is the Homo sapien diet. There's
The Homo sapien diet.
unless you're another creature.
Yeah. Do we have grinders? You know, we talk about vegetable eaters.
Yeah.
Look at horses. Look at cows. They grind because, and they have multiple stomachs, which are a heavy cellulose thing. Like people go, oh, kale, that's the next thing. So I look at a piece of kale,
Yeah.
and then I look at, let's say, a ripe navel orange, kale, or a ripe navel orange, or a ripe peach off a tree.
favorite.
No question. Forget the kale. Here, I'll feed that to my rabbit.
Yeah.
And then I'll eat the. If you're going to eat the kale, eat the rabbit dung because it's pre-digested,
Yeah.
you know, and it won't
At
kick you
least.
so much.
That's funny.
But look at the different species have different body type, multiple stomachs or one stomach.
Yeah.
Their GI tract is either long or short. The carnivore obviously has no ribbing in their GI tract.
Right.
It's smooth because the less absorption, the better. We're
Right.
designed for maximum absorption.
Yeah.
Why? So when you ask why these designs go by ingested chemistry, oh, that doesn't matter, does it? Nature seems to think it does. So you have a different design for different species that have different food sources. Thank you.
Yeah.
A man just got into omnivorish thinking, and that's where he lives, paleo thinkers and stuff, but in a setting of wellness and health, those things don't exist.
No. They will only make you weaker.
Only make you
Yeah.
weaker, sicker, and more sick, because that's what you're eating already. Look at what you're eating, and if you don't change that, then don't bitch that you're sick.
Exactly. Yeah.
I mean,
Yeah.
what are you doing in your lifestyle?
Yeah.
You can blame the ethers and God and bacteria all day long.
And there's not one person that I've met who eats, a high protein diet that doesn't have issues.
Exactly.
Not
I've never
one.
met it either.
It will get you
Look
at
at
some
that poor
point.
lad that we
Yeah.
have, that we showed you his colon removed.
Yeah.
Oh,
And
that's
his
good.
pictures before that is beautiful. I've never seen a bodybuilder so pretty as him. He was beautiful.
Wow.
He's one of those you see in romance novels, you know.
Yeah.
But because of the high protein diet, they had to remove his whole colon. And he's a young lad, you know, in his 20s.
And that's another thing, just removing parts of the body
Yeah.
and you
Yeah.
can just
Well,
regenerate
acids
and
destroy.
fix. Yeah.
Acids destroy,
Yeah.
chew you up, burn
Yeah.
you and chew you up. Look at endometriosis, an extremely acidic condition of the uterus, right?
Yeah.
Interstitially, it'll weld your uterus to your bowel wall. Look at the women when they go into our hysterectomy, they have to give you a resection with it, or
Oh.
cut the uterus off the bowel wall.
Yeah.
So
All those
sad.
acids.
Heat, acids, weld.
Yeah.
I mean, you just got to realize what's going on here. And when you do, it's an aha moment. And then you're pulled out of the medical ridiculousness, that negative atmosphere, into an atmosphere of love and healing and feeling good and getting the body feeling good and mobile and flexible again.
Yeah. Yeah, that's
Good
true bliss of living. And if you have any kind of swollen glands, swollen lymph nodes, cysts,
Warning, warning,
huge warning.
huge warning, get your kidneys filtering.
Exactly. What does that turn into later on? The body isolates pockets and creates a tumor, right? And then it becomes hard, and then the
Exactly.
cells start to change, and then you think that you have
And
this
then
disease.
chop or
that-
chop
yeah.
or whatever, or chop your neck out or
Right.
whatever, you know.
Exactly. Well, I'm so happy that we bring this information, and thank
Yeah.
you so much. And before we finish, we want to talk a little bit about spirituality because, I mean, it's such a huge, important
It is
part,
important part.
of what we're doing, and
Because the
yeah.
average Homo sapien doesn't realize he's not a Homo sapien. Remember, I told you guys,
Right.
you got to quit being humans. If you want to start understanding God or that which you think is the Creator,
Yeah.
then you have to quit identifying with creation.
yeah.
You know, you can't understand the Creator by looking at creation always. You have to look at yourself because you're the living presence, right? The living truth. There's no one outside of your world. You can bring a lover in or something, but you're still going to be you with that situation. No matter, you can run and hide in a closet, you're always there. There's nowhere you can run and hide from yourself. So when you take that a little further and you take some time alone and you sit and you start going within yourself and just getting away from thought.
Yeah.
You know, people don't realize your mind is what is your creator. If you're always following and chasing thoughts, you're always thinking, then you never can see truth. And that's what man is involved in. Academically, they teach you to keep thinking, keep desiring, and keep planning. You got to have that nice new house. You want to have a car with it. That's the American way in our
Right.
country. You know, all those kind of things like that.
They
You want to be
attach
like
you.
the Joneses and things like that. You know. So they keep you in a process of always thinking. Well, if you're always thinking, that's where your attention is on your thoughts.
Right.
How do you know truth if your thoughts are being conditioned by others?
Exactly.
Schools and everything else, churches, governments.
Yeah.
So freedom is when you break that. You break the chain of thought. And you can only do it with observation. Moving from thinking to observing. And when you do that and you can break that, you just opened your door to the heavens.
Oh yeah, yeah, and just that stillness and that presence,
Oh.
right? That ultimate presence, not thinking about what you have to do later on, just being
Right.
present in that very moment.
Exactly.
And what about that woman that was in class that shared her story that she actually was able to control her blood sugar by going present in
Sure.
the moment and speaking, you know, to her
Absolutely.
body.
Look
As
at
the
the people who've been
observer,
under surgery with biofeedback.
Yeah,
So, but you realize that you are not your body. You're only using this. This is your car, your vehicle while you're on
Right.
this planet. So who is the you?
yeah,
Right? And you're not going to know if you're too busy playing with your bodies. The mind is a body you're using. Your emotions is a body you're
Yeah.
using. So what's the reality of the user?
yeah,
Who's watching the show here? Who's playing here?
yeah.
And how do you find that out? Fun stuff, isn't it?
Very
I
fun,
tell you, I love
yeah. Mm-hmm.
spirituality. It is an awakening process of who you are and getting away from creation as opposed to the creator. Right?
Exactly.
Or the actor, you're becoming back to the director instead of the actor.
I think it's amazing that there's so many people out there all on different spiritual paths and journeys, and you know, finding what diet works for you, you know, can be this tread through mucky waters experience. And one thing that I think really helped me, Dr. Morse, find a little bit of an edge with my spiritual journey was changing my diet from a paleo and ketogenic diet to a frugivore diet. And
Changing your spirituality big time, doesn't it? It does. It
that
quiets your
frequency
mind.
really connects. Like, talk about the angstroms, right?
Oh,
About
yeah.
the fruit.
Oh.
And then when you actually ingest that and being able to tap into higher levels and finding that.
It's hard for man to understand how consciousness manifests, and that what manifests is consciousness. And you have to go back to quantum physics in the latest study, where they found that all chemistry is nothing but frequencies of electromagnetic energy, which is physics, right?
Yeah.
But that energy has intelligence.
Energy
Well,
has intelligence. That's my favorite line.
exactly.
Yeah.
So that's the bridge from the mundane sciences to the etheric. And I always said that quantum physics is like the metaphysics of physics, you know, because
Right.
they're open to expansion of
Right.
awareness of atoms and electrical magnetic energies and stuff like that. So that's the leap to understand that there's intelligence behind every eye, behind every plant, behind every
Every
animal.
thought.
Yeah, look at that with the plants. They're gonna take the dogs out of the airports because they're only 70% accurate in determining bomb materials. They're going to put plants in airports because this lady professor has trained her plants to identify 100%, not 70 like the dogs, 100% of bomb chemicals. And she's trained her plants to turn colors depending upon the chemical they are interpreting. And then the secret life of plants, how plants know you, love you, or are scared of you. I mean, you have to understand everything is alive at one level or another. Just because your perception can't perceive it, quit thinking. Get out of yourself and your thoughts and become conscious, and then you'll see the consciousness that flows through all things. Pretty cool stuff.
For beginners out there trying to improve their spiritual journeys, besides eating fruits and elevating your consciousness through diet, do you have any other tips?
Stop thinking.
It's just stop thinking
Stop
entirely.
thinking. Stop desiring.
That's so hard for me.
Just take. All right, do it this way.
everybody.
Do it this way. Then take a month.
Yeah.
Take a month. Say this is just like you're going to do on a raw food diet, right? You're going to
Okay.
do a month on
Yeah.
grapes, right? But just
Right.
do a month. Start a week out. Then just start a week. Say this week I'm not going to think. I'm going to play the observer. So I'm just going to watch. I'm not going to think. As soon as the thought comes in, I'm going to push it out. I'm just going to watch. I'm going to watch the traffic. I'm going to watch people. I'm just going to watch. And when you can break that thought, that thinking so much, then observe the energy around people. Because as you watch, they expose because they're busy thinking or whatever. You're going to see things you never saw before because you were lost in thought.
Right.
And when you quit thinking, your awareness goes poof. And the more that you do that, the more that you see things, the more you understand things. I just have to tell you, you connect with the universe and you connect with the creator of all things because that is what's conscious, obviously.
So
What gives all life awareness?
Yeah.
Obvious, and that's where you're going. What gives you awareness? You tap into your awareness, you've now tapped into everybody's awareness. Fun stuff, good stuff.
So finding that presence.
Finding that presence, but the first thing you have to do is stop thinking. Thinking is it's a tree of knowledge in Christianity. When you take from that pulls you into creation. Thought, the mind, is not consciousness.
Exactly.
Right?
It's a tool.
It's
Yeah,
your
it's
tool
your tool.
of how you create your ride, your journey in creation. You can't have anything in your world without first thinking about it.
Exactly.
So thought is the instrument of movement and activity in creation. Desire motivates thought.
Right, and that's how manifestation happens.
Exactly, that's how
right?
manifestation happens. If you
Yeah.
want to stop manifesting because of the karmatic bond with that,
Right.
then you quit manifesting, become the observer, quit desiring and wanting things, and it'll all come to you.
Exactly.
The ironic part of this is when you quit desiring it, it all starts to come to you.
Because your
Exactly.
vibration gets so
Right,
high and you get so
exactly,
pure,
exactly.
right? All of these other worlds open up to you. And I know, I love following gurus from India and
Fun
watching
stuff.
everything that they're doing. And if you ever read Autobiography of a
Oh,
Yogi,
of course. Yogananda, of course.
yeah,
all of that.
yeah, and you really
Matter of fact,
see.
Jensen sold his Help Valley Ranch to the Yogananda Fellowship, and they raise flowers and send them around the world out there. Been out there.
Yeah,
I like that.
It's all a beautiful thing.
Yeah.
It's all levels. There's all kinds of levels you can experience. Yogananda was a certain level, Sai Baba's a certain level, the Ek Master's a certain level. So
Yeah.
everybody's at certain levels.
yeah,
And you just, wherever your level is, there will be a being there to help you. If
Right.
you're listen and if you're awake. But if you're busy thinking and planning your own stuff, your own ego and everything's going, you can't hear when the master whispers in your ear.
and that's the true, beauty and reward of life, right? Is to get there. If you're just caught up in the material side of things, and yeah, it's fun. We're here to play and enjoy.
You're to play and enjoy.
But if you attach yourself, you're going to be stuck in that loop, right? Because
Well,
you're
put it this way. If you put a kid in Toys R Us, right?
Yeah.
A huge store of toys. Give him a month or two, he'll get tired and want to come out and go somewhere else. And that's the thing is, how long have you been on your journeys? Those people that listen to spirituality are about ready to close the door on creation and wake up again.
Yeah.
There's others that just got here, they're going to be playing and having fun. Who cares? Everybody's at a different level.
Of course,
If you want to wake up and get the highest level, you can't quit thinking. Quit planning. You don't have to follow anything because you're the living truth yourself. There's nowhere to go. There's no doorway to open up. Oh, there's God. It's not that. Remember, omnipresent, omnipotent, omniscient. What does that mean? The one. Fun stuff.
I
Thank
love
you so
it.
much for answering our question.
Thank you.
Oh, you're welcome. Thanks for coming, guys. It's been a
course.
pleasure. It was a fun seminar, wasn't it?
Oh, amazing.
5 days again. That was
Yeah.
that was a long one, but we had to have the protocol section
Yeah.
and then the iris work. I love
Oh,
iris
it's
work.
beautiful. You can see the whole body in your
Oh
eyes, right?
man, iridology is the coolest science on the planet. And when you understand the lymph system in iridology,
Right.
It's key.
then you look right where your clients are suffering, and
Yeah.
you go, well, there's the tumor right there. There's the cyst right there. Yeah, you're so full of acidosis, you're burning everywhere. Look at that malabsorption ring. Right? Look at your skin.
Yeah.
Look at those kidneys. Look at the liver. Oh, your gallbladder. You got to fix that one. You
Yeah.
can see literally every tissue in the body. How beautiful
Exactly.
is that? If you know how to interpret it correctly.
It's
And
amazing.
then how do you fix it? So it's
Right.
our tool to say here,
Yeah.
and then this is how we fix you.
I love it.
It's good stuff.
It's like a window to the soul. Like really, it's like peeking in. It's like
Exactly.
taking a look and
Window
being
to
like,
the
what's
body.
going in on there? Yeah.
You are right
Window to
on.
the
It's a
body.
window to the inner workings of your body. Cellularly, cells and fluids. That's what your eye shows. That's what your body is. Cells and fluids. What else is there?
And it'll tell you more than any kind of blood work will, right? It'll tell you problems before you
Well, your
they
blood work
happen.
shows you
and-
indications.
Yeah,
When I look at blood work, your mineral imbalances, that you got to go with the adrenals and absorption and everything else. But
Yeah.
when you look at your bun, for an example, right, that's urea nitrogen. You can tell whether someone's doing a protein diet or not. Remember,
Right.
by their bun.
Yeah.
If their bun is above 4 or 5, which is a raw foodist bun, then you know they're doing proteins.
Right.
And in a detox, that's a big no-no, right? Then the creatinine, that's your kidney protein, and boy, that's what we look at big time, because if you're above 0.5, you're starting to get into trouble.
Right.
And they'll let you get up to 0.1, 0.5 or something before they even mention anything to you, and then they even won't, and by then your blood pressure's going up from it and everything else from it, and then they don't even know why you have high blood pressure, but they're looking at a creatinine of 1. I mean, this is the stupidity of them, and they can't even read their own blood work.
Yeah,
I know it.
yeah.
I know it.
I know. I get blood work back from patients so often, and there's high and there's low and there's all these indications. So they're like, "Oh, my medical doctor said everything's great."
Yeah, exactly.
Everything's
But
just
you
great.
notice that when you start detoxifying, that
Yeah.
the blood work ends up perfect.
Yeah.
And yet they'll have a tumor right here. Well, wait a minute. Why would my blood work be perfect and a tumor over here? Because your tumor has nothing to do with your blood.
Mm-hmm.
I mean, that's what people don't realize. You have a separate system. This is the lymphatic system. This isn't the blood system. You might see inflammatory markers in the blood, letting you know that acidosis is developing in the body, like your C-reactives and stuff like that. But I never even read those, because you know where you're going to take them, where you got to take them. I look at the TSHs and stuff like that, gives you a little insight to pituitary or not, or if that weakness you see, that lacuna in the pituitary, is actually having an effect on TSH production, or PTH, or whatever. And so that can be somewhat valuable. But
That's why this program is so amazing, because it doesn't matter what disease that you've been diagnosed with or where you're coming from, behavioral issues, tumor, the ADD, ADHD, it all comes back down to the same solution, same program.
That's got to hurt too.
Yeah,
I know.
Because one guy said Dr. Morse puts them all.
It's not that complicated.
I know.
Anyone can do this.
Yeah.
They did. This state was coming after me one time, and the news media was all over me, and so they interviewed this one medical doctor. He says, "Well, he puts everybody on the same program," and I'm going, "Yeah," because then they can't get you for practicing medicine without a license, because you're not treating diseases with the same. I give everybody the same thing for all these different diseases, right? So that's that sort of thing. It's like they're stuck. They have a serious problem, and they're getting into trouble because of you guys and me and everybody else, because we're showing people the truth. We're teaching them, and we're demonstrating it by the thousands that are getting well. And so it's like, you either get online or you don't, because we're exposing the truth, and you better get with it, guys, because people are smart out there. They've just been lied to.
And once you feel it, it resonates. Once you experience it, you're like, just try it, right?
Just try it. What do you have to go wrong by just doing a week of fruits in the morning, a salad for lunch, and maybe fruit at night, a little light supper, or do fruit all day long and a salad for supper? And just try it for, Dr. Oz took those 12 people right in the zoo, and for 10 days or whatever, all raw. All right? So all their stats came down. I think he forgot that in his show. Pushing supplements and all that. It's about the money. And it's like, but that was how I learned about Dr. Oz, was taking those 12 people or whatever to the zoo and putting them on raw foods. We give that challenge to your followers. Go on a week or 2 week raw food diet. The nutrition is higher than anything you've been eating, so you're not nutritionally deficient. So what would be the argument? It's not my steak and potatoes.
You're the best.
Well, I mean...
Farm boy.
Thank you for just helping us get this information out there. And anyone in Toronto can reach out to Lisa and I.
Love to do it.
We're all about helping people, and Emily, and we just want to spread the message. So
fun stuff. Because we need to get the naturopaths awake and get away from medical thinking. This is the worst thing that can happen to naturopathy or naturopathy is the whole idea of naturopathic medicine. It's an oxymoron. Naturopathy is the science of nature. It takes in chemistry, it takes in physics. We're not pseudo or nothing. We take in chemistry, it takes in physics. We'll stand on those pillars any day of the week, and any jury, any courtroom, anywhere. We'll stand on those pillars of chemistry and physics. What are they going to stand on?
I know.
Because their theories are so bizarre.
It makes zero sense.
It's just bizarre. It makes zero sense. And a lot of these universities, we're always looking at science and science newses and stuff, and even science and universities cannot match some of these studies. They claim that that are viable for what their belief system is. They just can't match them, and so some of the universities I won't mention are going, maybe not truthful.
And the only time they study fructose is, someone sent me a study that said the title was captivating, saying something like, all fructose is bad for you, it's cancer causing. And then I opened the study and then I checked what they did, and it was a study on Kool-Aid.
They use Kool-Aid.
See, that's how misinformation.
That's
You hit
tricky.
it right on the button. That's how
That's tricky.
misinformation
Yeah.
has gotten out there, and then people feed off of that
Right. Oh,
misinformation.
fructose is bad.
I know, it's like
Yeah. No, Kool-Aid is bad.
See, that would be the
High fructose.
negative forces trying to instill. Don't get into the healthy side. Don't get away, because remember, you have two forces at play in your world.
Yeah.
You have two voices speaking to you. Which one you're going to listen to?
Yeah.
Right.
Maybe neither one. Maybe go to the voice
Center.
within, the big voice.
Right. Yeah. We
that'd
have
be
all
the
the
one.
answers within,
Exactly.
right? And that's
Exactly.
just trust.
Pleasure, ladies.
Yes,
Pleasure.
thank you so
Thank
much
you all.
again. Thank
we
you
love you
for
all.
listening.
Thank you so much.
And
Thank you to everyone who tuned in and posed all your questions and for your love and support.
Thank you. Have a nice day. Thank you so much.